Dr. Jones, I want to talk to you about gum disease, periodontal disease, gingivitis. To me, it's all the same. It's just a different name and a different stage, maybe. But in the end, it's an inflammation, an infection in your gums. Would you agree?
That's right.
Good.
Yes.
Now, I have a question about that. Almost every dentist, when he tells you that you have gum disease, the first thing out of his mouth is that you will be losing your teeth.
That's right.
Sooner or later. 1 year, 4 years, 7 years, you will eventually lose them. Now, here's my thing. Here's my beef with this whole thing. While this is very, very bad to a degree, losing your teeth, okay? Because, well, it's bad. However, it costs money, all kinds of things when it happens, a fair amount of money if you want to do it, and all kinds of things. But here's the thing. At the very least, one thing is for sure, dentistry has advanced phenomenally, and we have talked about implants, crowns and bridges. There are even dentures which are implant supported, so they're relatively cheap compared to a whole set of implants, and yet apparently they're fantastic, and we're going to talk more about it one of these days. But the point is, dentists are good. We're not anymore in a time where George Washington, who apparently had a wooden tooth, this must have been awful. But here's what I think. While you have a gum disease, it's an infection. It's that yellow, reddish, ugly pus in your mouth.
Yes.
The gateway of your mouth, blood vessels. There's nothing goes through the blood faster than all this thing around here. It drips down. It ruins the liver. It ruins the kidney. The diabetes system gets higher. It ruins the immune system. Babies get born underweight and premature. In fact, here in California, there was a baby stillborn because they found gum disease stuff in the placenta of the woman. Now, isn't that stuff a lot more devastating than the missing teeth? Which you might have to spend 20 grand to fix them, fine. If you have it, if you want to, go ahead. But at least it can be done. Isn't that other stuff much less repairable? Because over those 4, 5, 6, 8 years, how the hell are you going to get your kidneys back? I mean, I'm not saying they all fail, but you get my point. Shed some light on, tell me how far.
Absolutely, and I'm amazed with you. No, you're not off at all. I'm amazed with you. How many patients that we will tell that they have gum disease. In fact, Helmut, did you know, just speaking dentistry, not even the whole body, that more teeth are lost due to gum disease than to decay or to fracture or any other. In fact, if you combined all those other reasons, they still wouldn't add up to the total number of teeth that are lost just primarily due to gum disease. And of course, when there's gum disease comes the bone loss. So the bone loss now, if you have gum disease and you're losing teeth, the bone is already gone to put dental implants in. So let's go back, though, instead of just the dental issues, which are many, let's go to the systemic diseases. The diabetes. Did you know that there was a study done where all they did with 100 patients who were on medicine for their diabetes, all they did was clean their teeth and take care of their gums. And did you know that the blood sugar overall for this whole group went down by 30%? All they did was take care of their teeth. All they did was take care of their gum disease. And some of the people could go off of their medication because of it. That's how important that is.
Wonderful. Absolutely. So you agree that, never mind the smelly mouth. A guy got to have a smelly mouth when he has that gum disease going on. And all the Listerine isn't going to do it. All right. So, but the point is, this is important because is it true that a gum disease in a mouth, a nice, decent gum disease, which doesn't take too long to, almost like a rotten apple in a basket, it doesn't take too long to get every apple rotten, right? Same here. That doesn't mean the teeth fall out right away. But so that disease, that inflammation is almost as big as a person's hand. Is that true?
Oh, absolutely. In fact, Helmut, one of the things we have suspected this in dentistry for years and years, but it's only been in the last 4 or 5 years that we've had the research to go behind it. In fact, did you know that some medical insurance companies are paying for pregnant women to have their gum disease treated because they know that their costs will be less overall than that baby being born underweight with other problems that they have. So the medical insurance is now paying for pregnant women to treat their gum disease. It's extremely important for people to understand.
Anytime an insurance company volunteers to fix something so there's no bigger problem, you better fix it.
They never do that. Exactly. They're looking for more ways not to pay you than to pay you. And so when they come up with that program, that's got to be a very, very important issue and a money-saving issue for them. And so how real and important that is for all of us to understand what an effect gum disease has on our entire body. Right. That infection that is just dripping into our system every day. Not only does it have an effect on our diabetes and the birth weight of children, but did you know that the inflammatory process is one that actually contributes to heart disease and the atherosclerosis, the hardening of the arteries that causes us to have strokes and causes us to have heart attacks. All of this is
dementia, forgetfulness, because the blood doesn't get
all of that.
All of that. Well, you see, if a person has let's just say like a quarter or a dime of an infection on his hand, it kind of like, for more than a few days, a week or whatever, he will go to a dermatologist, as he should. Yeah. And here he has a handful of it in his mouth, and he doesn't do anything about it.
And he doesn't do anything about it.
And you mentioned
Gum disease sneaks up on us. It comes on slow, Helmut, and for a lot of people, they don't know or they don't think that they have a problem. And so it's really, once they understand, yes, I do have a problem, they really need to get that taken care of, because it has so many just devastating effects that can happen to their body.
Right. In fact, you mentioned something about the insurance companies recognizing that and promoting that treatment so that further problems are not there, especially with pregnant women and stuff. I mean, who wants to be maybe still getting pregnant, wanting to get pregnant, and then but they, I mean, it's like a druggie, like a drug mom will pass on the drug. I mean, this is what this is. But let's go back to the MDs, to the surgeon. The guys who do hip replacement and use the same titanium that you use for the implants, the guys who do Pendex and tonsils and whatever. Yeah. I have heard that only lately, 4 or 5 years a little bit, give or take, most of those surgeons, before they engage in such a surgery, be it appendix or a hip operation, they will ask the patients to get a clean bill of oral health. And they're not talking about Julia Roberts' smile. They're not even talking about a cavity or two. They're not talking about TMJ, a misaligned. They are simply talking about get your gum disease fixed, because if not, my cut might get infected. And even if it doesn't, your body is so weak that if I weaken it by cutting it here or again with my surgery, you might have major complications. Everybody knows that a surgeon will not operate on your hip if you have a major lung infection. Well, a major gum infection apparently now is leveled up to the same, no good.
That's right, because the bacteria that's in your mouth all the time can inoculate your whole bloodstream. And if they're doing surgery or they're doing a hip replacement, they do not want bacteria floating around in your body to enter the place where they just did surgery to cause a major and maybe even a failure of that hip surgery. So they will not do that surgery if you have a gum infection and you have not been cleared by a dentist before you have that surgery. Absolutely, Helmut, that's a very real problem. And we see that all the time where hip surgeons have done hip replacements and there's been an infection and they've had to go back in to replace that new hip that they just got. And we're not even talking about the pain and the suffering that the patient had gone through. And the days and weeks that they have to spend in therapy or in the hospital to have that replaced, all because they had a gum infection before they started.
Exactly. Now, while the things which we talked about here, some of that is a little bit, so to say, doesn't happen all the time in that severity, thanks God.
Sure.
But imagine if it came to something so severe. Wouldn't it be putting down your immune system? Wouldn't your next flu season, which for sure is going to come, it doesn't matter where you live, twice a year these days or 3 times a year these days, it's going to come. Never mind the swine flu or the bird flu, just the normal little, type of infections running around. Wouldn't one get that a lot easier? I mean, the potential of it.
Absolutely, sure. Because your immune system is fighting off your gum disease. And if all of your immune system is trying to help you fight your gum disease, which is a losing battle, by the way, unless you have it treated, then your immune system will be all spent with the next time the flu season comes around or another bug is introduced into your system. Your immune system will not be as healthy and strong as it could be. You're absolutely right.
Well, I have some time here today, Doctor. I'm going to cut our interview short. Let me go to my dentist, check my gum disease. Bye-bye.
Good idea. Bye now.